This new MOU between the Republic of Kenya and the United Kingdom on healthcare workforce and UK-based health and education institutions, on the establishment of Kenya-UK Health Alliance, I believe will create a platform for not just health worker exchange, but total capacity building of healthcare professionals, not only in Kenya, but also in the region, who will also take advantage of this partnership. But more importantly, also strengthen our management of cancer, and indeed, as has been said as we walked around the tables, the ability for us to be able to explore, study, and understand better different cancers, how they affect different populations, and therefore be able to be in a much better position to provide our people with the kind of health care that they deserve. I want to end my statements by basically expressing Kenya's total appreciation for the critical support that we have received from all of you here in the UK, in the health sector, but also from Her Majesty's government throughout the decades. This gesture of generosity has complemented Kenya's development agenda and impacted positively on the social economic development of our country, and we truly, truly appreciate it. Once again, I want to express our deep pleasure at having had an opportunity to be together with you this morning, and my commitment to continue working together with you towards enhancing Kenya and UK partnerships, especially in the health field, and I really look forward to seeing many of you back home in Nairobi. Look forward to welcoming you again as we continue to work together. And I want to conclude by thanking you once again for that offer of those 2 scholarships at Manchester. This will be highly appreciated. We've had a very effective partnership between Kenya and the United Kingdom, a solid partnership in research and cooperation since the early 1980s through various programs between the Kenya Medical Research Institute, which is KEMRI, the Wellcome Trust, and UK Aid. And this cooperation has immensely contributed to the advancement of medical research in Kenya in so many different ways. We also appreciate the Kenya and UK collaboration in the COVID-19 research, which has enabled KEMRI also to perform serosurveillance, modeling transmission, and vaccine testing. And this work will greatly help us as a country to model our health system capacity and to determine how best to enforce the capacity of the system to manage COVID-19 cases. Kenya and the United Kingdom, however, last year agreed on a strategic partnership agreement based on 5 pillars of mutual prosperity, security and stability, sustainable development, climate change, and people-to-people connections. Activities and potential areas for health collaboration cut across all these pillars of our strategic partnership. In this regard, as 2 governments, indeed as has been said by previous speakers, have developed a memorandum of understanding in the field of health to actualize the strategic partnership between our 2 countries. This MOU will focus on our health systems, strengthening them, supporting each other in health research, but also to increase investment, trade, and partnering also in global health, security, and surveillance, but also more importantly for me, in providing opportunities for Kenyan nurses, while at the same time providing training opportunities for those who are still at home, as we work together to develop centers of excellence, both at Kenyatta University, but also at Kisii Hospital.
In addition, the Christie and Manchester University Foundation Trust will provide training places for current healthcare workforce to obtain specialised oncology training and an understanding of how the hub and spoke model for cancer care services works in Greater Manchester. These ambitions can only be achieved with ongoing support and investment. With this in place, these approaches will generate a comprehensive cancer service based on clinical service, research and education. The Kenya-UK Healthcare Alliance is imperative to making this vision a reality, and the University of Manchester is proud to host and lead this alliance with our close colleagues in the Christie Hospital, Manchester University Foundation Trust, Health Education England, and our new colleagues across the alliance. However, Your Excellency, the University of Manchester is not finished here with leading the Kenya-UK Healthcare Alliance. Our colleagues in the Faculty of Humanities and the Faculty of Science and Engineering at the university are looking forward to the autumn, when they will host, along with the Kenyan High Commission, 4 on other Big Four initiatives, including affordable housing, food security and manufacturing. This is a long-term commitment from the university to Kenya to work together in developing innovative ways to improve the welfare of all Kenyan people. Lastly, to mark the launch of the Kenya-UK Healthcare Alliance, the University of Manchester and the Christie Hospital will establish 2 scholarships each. The President Jomo Kenyatta Scholarships to help support Kenyans to undertake master's level studies at the university or clinical fellowships at the Christie Hospital. Asante.
So for 30 years, the Kenyan Medical Research Institute has been working with the Wellcome Trust and the University of Oxford on the most cutting-edge research. And we've made global health funding opportunities at our National Institute of Health Research open to researchers and institutions in Kenya. They are all living examples of our UK-Kenya health partnership, which we are all here today to help celebrate. It may have only been formalized a year or so ago, but early this year, I think it was formally put together, but it's been saving lives for for decades. And Mr. President, it helped to drive on your Big Four visions for your country, the vision here of affordable healthcare for everyone in Kenya. And as we look to strengthen these bonds, we need to make sure that these opportunities are available to frontline workers too. Healthcare professionals all across the world have been the heroes of the pandemic, and we owe it to them and give them the opportunities that they need to develop.
Thank you. Thank you.